November is Bladder Health Awareness Month, so joining us today to talk about solutions and resources is Dr. Melissa Kaufman, a Vanderbilt University Medical Center urologist, and her patient, Dr. Linda Brice, a former captain in the United States Air Force. Thank you for joining us, but I have to know, first of all, what is overactive bladder?
That's a great question, Jordan. Overactive bladder is basically a group of symptoms that a person can experience, and it's characterized by urinary urgency, which is a really sudden and compelling desire to urinate. This is often associated with frequency of urination, which can be daytime and nighttime, and sometimes also associated with leakage of urine.
Mhm. And what causes it, Dr. Kaufman?
Yeah, there's a wide variety of issues that can result in these kind of bladder symptoms, but let me add in right now that very rarely is it something that's imminently worrisome. There are associations with aging, with hormone loss, with prior surgeries, but sometimes something just as subtle as back strain can result in these symptoms.
Oh,
So
interesting.
although it is not expected, it is not a normal part of aging. Even if this is not anticipated, it is exceedingly common. It's estimated that there's some 37 million Americans who have these types of bladder symptoms.
So it's nice to
And
know
these
that you're not
symptoms,
alone in this, but obviously not
right.
something anyone wants to deal with.
It's more prevalent sometimes than diabetes or high blood pressure.
Really?
Yeah, and the symptoms can range from a simple nuisance to something that's truly debilitating. But what I've seen is that people are exceedingly reluctant to come and seek treatment because these are very delicate and very intimate conditions. I mean, Dr. Brice, what finally catalyzed you to come and get treatment?
After 4 years of suffering with incontinence, I decided it was time to speak with my doctor. I had everything from gushing of urine at a moment's notice to, having to figure out where the closest bathroom is, to wearing black so that if you had an accident, nobody could tell until you could go change. But I was a nursing professor and I taught classes, and I would have to interrupt my classes to keep running back and forth to the bathroom. And then I decided to to not drink any fluids, because if it didn't go in, it didn't have to come out. Unfortunately, then it started to affect my kidneys. So it was important that I finally went and talked with my doctor, and then was able to talk with a specialist. Dr. Kaufman is my hero. She helped me get the Medtronic's InterStim device implanted, and it has given me freedom and a quality of life that I hadn't had. And I recommend it to everybody. Don't suffer in silence because it's a subject that you're afraid to talk about. Go ahead and talk with your doctor.
Yeah, I mean, do you have advice? What's a good way to start that conversation? And also, what are some other treatment options, or is this the best one?
Yeah, the diagnosis of overactive bladder may just require a visit to the clinician, a physical exam, and maybe a simple urine test, and then we can begin to discuss all the treatment options. Sometimes just dietary fluid modifications, lifestyle modifications can be powerful, but many patients will start to utilize medications. And then there's a subset of patients like Dr. Brice that will move on to surgical therapies. But you do want to speak to your primary care provider, to a local urologist. But there's things that your viewing audience can do today. You can find reliable and accurate resources online. And one of those places is at controlleaks.com/now. This has a bladder information portal where you can learn more about your condition and find access to appropriate providers.
Right.
I like what you said, though, that this is common, but it's not a normal thing with aging. So if you are seeing any of those symptoms, you should definitely go talk to your doctor. Again, can you give us website one more time for the resources?
Absolutely. It's controlleaks.com/now.
All right. Thank you both so much for joining us today. And Dr. Brice, I'm so glad that everything's working out for you.
Thank you very much. We appreciate it, Jordan.
Yes,
You
thank
have a great day.
You too. And if you'd like to see this segment again, just head on over to firstcoastliving.net.